Imagine this. You've been planning your dream vacation for months. The flights are booked, the hotel is set, and your suitcase is ready to go. But just before you leave, you catch a viral illness that not only ruins your trip, but also forces you into quarantine overseas. Sounds like a nightmare, right? Well, that's exactly what health officials are warning travelers about as measles cases rise sharply across Europe and other parts of the world. For American viewers, this story may not seem directly about us, but it is. Because global travel connects everyone, and what affects British tourists today can easily become a concern for Americans tomorrow. So let's talk about why measles is making headlines again, why travelers need to pay attention, and how a simple vaccination can save you from a ruined vacation and a major health scare. First, let's break down the numbers. According to health authorities, measles cases have been climbing significantly in recent years. Back in 2016, the global situation seemed under control with relatively few reported cases. But fast forward to now, and the numbers are much more alarming. In some areas, tens of thousands of infections have been reported in just a single year. More than half of those infected ended up in the hospital, and sadly, dozens of deaths were recorded. This isn't just a minor rash or a temporary fever. Measles is a serious, sometimes deadly disease. These statistics underline why doctors and health agencies are urging travelers, especially those leaving from the UK, to make sure they've had their 2 doses of the MMR vaccine. So what exactly is measles? In simple terms, it's a highly contagious viral illness that spreads through coughing, sneezing, and even just being in the same room with someone who has it. At first, it feels like the flu: fever, runny nose, sore throat, and coughing. Then, a few days later, the classic red-brown rash appears, starting on the face and spreading across the body. But here's the dangerous part. Measles isn't just about the rash. It can cause pneumonia, brain swelling, meningitis, and even permanent vision loss. In severe cases, it can be fatal. That's why health professionals are treating this resurgence as a very real public health risk, especially for travelers who might be exposed in airports, tourist destinations, or crowded events abroad. The World Health Organization has sounded the alarm, reporting that measles cases in Europe have surged to a 25-year high. More than 127,000 cases were recorded in just 1 year, and experts say the trend isn't slowing down. This is a big deal because Europe is one of the top international destinations for British and American tourists alike, from summer vacations in Spain to winter getaways in France. Millions of travelers pass through these regions every year. With such high case numbers, the risk of exposure is very real. This is why both the UK Health Security Agency and global health experts are reminding travelers to double-check their vaccination status before stepping on a plane. For many people, the measles vaccine is something they got as a child and then never thought about again. In most countries, the MMR vaccine, short for measles, mumps, and rubella, is part of the standard childhood immunization schedule. But here's the thing. Not everyone received both doses. And without 2 doses, full protection isn't guaranteed. Some adults may have missed their second shot, while others may not know their vaccination history at all. That's why health officials are telling travelers to check their medical records or speak with their doctor before traveling. If you're not sure, it's better to get the vaccine now than risk catching a disease that could derail your trip and your health. Now let's look at what can actually happen if a traveler gets measles abroad. At best, you might have to cancel your plans and spend a week or more stuck in a hotel room, feeling miserable with fever and rash. At worst, you could end up hospitalized in a foreign country, facing expensive medical bills and treatment delays. Quarantine rules also come into play. Many countries will not allow someone with measles to board a plane until they are no longer contagious. That means canceled flights, extended stays, and additional costs. And let's not forget the risk of spreading the virus to fellow travelers, hotel staff, or even family members who may not be fully vaccinated. For pregnant women, the risk is especially concerning. Contracting measles during pregnancy can lead to miscarriage, premature birth, or low birth weight. Children under 1 year old are also at higher risk because they may be too young to receive the vaccine. This makes herd immunity, where enough people are vaccinated to protect those who cannot be vaccinated, extremely important. When vaccination rates fall, these vulnerable groups are the first to suffer. That's why travel health experts are not just talking about personal protection, but also about protecting the community at large. Some travelers may be wondering, do I really need to worry about this if I'm going to popular developed destinations like Paris, Rome, or Berlin? The answer is yes. Measles doesn't care about geography, and outbreaks can happen anywhere when vaccination rates drop. In fact, tourist hotspots are often where diseases spread fastest because of the sheer number of people from different countries mixing together. A crowded airport terminal, a packed concert, or even a busy theme park can quickly become a hotspot for transmission. This is why vaccination is considered the first line of defense for international travelers. So what can American travelers learn from the UK warning? Even if you're not based in Britain, the advice applies to you. Before traveling internationally, especially to Europe or other regions with recent outbreaks, make sure your MMR vaccination is up to date. If you're unsure, schedule an appointment with your doctor or local clinic. The vaccine is widely available, safe, and highly effective. Alongside vaccination, health professionals also recommend basic precautions like frequent hand washing, carrying hand sanitizer, and avoiding close contact with people showing flu-like symptoms while traveling. It's also important to know that travel health isn't just about your own trip. It plays a role in the bigger picture of global disease prevention. When unvaccinated travelers bring measles back into their home countries, it can spark new outbreaks, even in places where the disease had previously been eliminated. This happened in the United States a few years ago, when measles outbreaks were traced back to international travelers. With more people flying across borders than ever before, personal responsibility has never been more crucial in stopping the spread. Governments and health organizations are stepping up their response as well. The World Health Organization, the Centers for Disease Control and Prevention, and national health agencies are working to increase vaccination coverage and raise awareness among travelers. Airports and airlines have also played a role by distributing health information and encouraging passengers to check their vaccination records before flying. But at the end of the day, it comes down to individual choices. Each traveler who gets vaccinated reduces the overall risk of transmission. The bottom line is this: measles is preventable, but only if people take it seriously. A quick check of your medical records and a simple vaccination could be the difference between a safe, enjoyable vacation and a costly medical emergency abroad. No one wants to spend their holiday stuck in a hospital bed, dealing with complications or scrambling to rebook flights. The MMR vaccine is one of the most effective tools we have to keep ourselves and others safe while traveling. And with global case numbers on the rise, the timing of this reminder couldn't be more important. So, as you prepare for your next big trip, whether it's to Europe, Asia, or anywhere else, make your health a priority. Take a moment to confirm your vaccination status, talk to your healthcare provider, and make sure you're protected. Travel is supposed to be about adventure, relaxation, and creating memories, not about fighting off preventable diseases. Stay safe, stay smart, and keep yourself covered so you can fully enjoy the experiences waiting for you overseas. Because the best souvenir you can bring home is good health and a trip that went exactly as planned.